Now, without further ado, I want to jump right into our morning keynote of someone for whom a little introduction is needed and for whom you have all come to listen to, not to me. So thanks for listening to me prattle on there for a minute. Elizabeth Hertel is the director of the Michigan Department of Health and Human Services, and a lot of folks in our audience know her. But without further ado, Elizabeth, let me just give you the floor and let you take it from here.
Thank you. Good morning, everybody. Thank you so much for coming this morning. I'm really excited to be here and to start this day of discussion and policy wonkishness, I guess, is where we're all at together. So I was asked this morning to speak about our learnings from the pandemic at the department and some of our priorities moving forward. There's so much to say and so much we've learned these past 12 to 15 months. One key observation is what we in health policy have known for decades. The way we shape our policies, not only what is traditionally thought of as health related, but also education, housing, food access, income, and more. And the way we carry out those policies have the power to impact people over a lifetime and the next generation, for better or for worse. In fact, of course, it is estimated that only about 20% of a person's health is determined by what happens in a doctor's office. So while these interactions or interventions are important, that means that 80% is made up of habits, behaviors, or the environment where we work and live. And that can be very overwhelming. It's a huge sphere of influence. But I like to look at the flip side, as you all know. What is the opportunity? And we have tremendous opportunities in this state to help people in their greatest times of need and over a lifetime. If we look at the policies we have now and ask ourselves, what are we doing to address needs and gaps now, but also to get down to the root factors or causes across the spectrum of health outcomes to improve those outcomes over swaths of time, decades, and generations? Are we thinking about the whole person and the whole lifespan? And how do we use the lessons that we've learned from the COVID-19 pandemic to improve those health outcomes? COVID-19 really emphasized the importance of the investment in a robust healthcare system and the gaps in investment and what has been inconsistent prioritization of healthcare in our state and across the country. I'm optimistic about the months ahead and that we are on our way to putting this pandemic behind us. We are steadily moving forward. Last week, we were still tracking outbreaks and variants, but our cases were down for the 5th week in a row, and so was our percent positivity. At the same time, our vaccinations continue to climb, even as they are slowing down. The rate is slowing down, but they're increasing. So right now, just over 58%, or just over 4 million residents, almost 5 million residents, have received at least one dose of a vaccine, and about 46% are fully vaccinated. That's more than 4 million people in Michigan. I want you to think about that. 4 million people out of a total of 10, just over 8 that are eligible for the vaccine, vaccinated in less than 6 months. That's incredible. But practically, from the first case of COVID-19 in Michigan, we saw what we knew were significant gaps caused by a lack of access, a lack of investment, and systemic racism. And these became chasms with deadly consequences. It was a condensed example of the factors that make someone more or less vulnerable from a health perspective, and one reason our department has recommitted itself to making sure that we are addressing the social determinants of health spectrum. That is something I believe we must all examine if we are to create significant and lasting improvements in health outcomes. During the pandemic, we worked really hard on education, testing, and care access, and thankfully, we were able to practically eliminate some of the racial disparities that we saw early on. Disparities in our vaccination rates have been a challenge, but one of our goals is zero disparities there. So in addition to the mass vaccination sites we had, like Ford Field, MSU Pavilion, and the DeVos Center, we're working with local partners across the state to walk neighborhoods, knock on doors, to reach people with information, set appointments, deploying mobile clinics, working with local health officials to reach our homebound individuals, and enrolling new vaccine providers every day. We know that there may be spoilage of doses in the next phase, but Michigan has been incredibly effective in our use of vaccine doses up until now. And we know that we may have one chance to start someone in their 1 or 2 dose regimen. So the priority has shifted from where we were in January or February when immediate demand exceeded supply to where we are now. But our priority continues to be shots in arms. Now we are at a point where we can move to make getting the vaccine as simple as going about your daily tasks. And that is really exciting progress. Our ability to sustain these tactics, greatly depend on our budget, both federal and state. So right now, some of the funding needed for this work has been working its way through the appropriations process at the state level. However, I am fortunate to work with an outstanding team across the board, and we will get as creative as we need to in order to reach everyone who wants to be vaccinated and put more shots in arms. We've been doing this for a year, and we will continue to develop these creative solutions to make sure that we are providing the services that people in Michigan need. We also know that, and we must do more short and long term for reducing disparities, which is why last year we created the Office of Race, Equity, Diversity, and Inclusion to look not only at this current health crisis, but opportunities to address health equity and inequity, diversity and inclusion in broader ways, externally and internally as a department. This work will span our programs and services, and I look forward to working with leaders like you as well. I'm also very pleased that Michelle Davenport, she goes by both kind of, has taken the lead in this office and moving these initiatives forward within the department. She's a great leader, and I'm really excited to be able to work with her on this initiative internally and externally. So if you do not know her, I would recommend that you reach out and introduce yourself. She will be an integral part of our success over the coming years. We know, and I know this group knows, our health starts even before birth with moms and babies. So our priorities as a department, our milestones this past year, and our opportunities ahead start there with our potential to extend across a person's lifetime and change the trajectory of their potential health, their children's health, and their grandchildren's. This year, we saw a really encouraging sign that we're improving in some areas on our path to healthy moms and healthy babies, specifically when it comes to infant mortality. And I know all of you have probably been watching these rates over the past years, as we have at the department. And in September of 2019, the department announced the release of the 2023 Mother-Infant Health and Equity Improvement Plan. Our work and priorities in this space align with the 2030 Healthy People goal, which is set by the U.S. Department of Health and Human Services to eliminate racial disparities in infant deaths. So the improvement plan includes a comprehensive statewide strategy to improve the health of mothers and babies to achieve the vision of 0 preventable deaths and 0 health disparities. And at the end of April, we announced Michigan had achieved a significant milestone in our efforts. 2019 data released by the department this year shows that Michigan had both the lowest infant mortality rate in recorded history and a measurable decrease in the disparity of death occurrences between Black and white infants in particular. And if we were in person, I would stop here so that I could hear the applause, because this is such a monumental achievement and something we've been working toward for so long. And to see any movement in those rates in the direction that we're hoping is so positive and reaffirming of the work that we've all been doing here. But we know there's always a lot more work to be done. So because of the challenges that we saw during the pandemic, there were also changes that we made that will prove useful, hopefully, in reaching moms and babies as we return to normal. Some of these were temporary increases in assistance that helped people get through the difficulties they faced this year, But I think we learned important lessons that could change the way that we approach policy and programs moving forward, regardless. This past year, we worked with our providers to address the limitations of a shift to primarily remote appointments, still capturing referral data and completing nutrition and health assessments. We set up a warm line last April for that more than a year later, so currently is still providing moms with support 7 days a week. We strengthened our partnerships, like one in Southeast Michigan, with the Southeast Michigan Lactation Consultants of Color to provide hands-on in-person breastfeeding support. And we worked with local agencies to create a virtual mom groups, moving classes online and setting up curbside pickup options for breastfeeding supplies. Really continuing to work to bring the services to people where they are. And if where they are is at home, then we're going to get there. That's our goal. Telehealth also became one technology that improved access over the past year. And this pandemic really sped up our adoption and use of telehealth across the state, which does help us get past some of those barriers like transportation. And I hope we will continue to make room and identify support to increase access in both urban and rural areas through telehealth. Michigan was also one of a handful of states that received USDA Tufts Telehealth Intervention Grant, and we were able to help families who faced hardship and felt the financial impacts of the pandemic by connecting eligible clients with other programs or services to provide hope and opportunity, increase access to fresh and healthy food. Technical implementation of this change was tested and implemented at the state system level, so allowing for seamless issuance of the food packages at the local level. Great coordination between different branches of government here. As we move forward, we are actively working to expand the use of community navigators, improving screening and health data sharing, which could also improve access to health coverage and other social supports as well. Last week, we announced that the department will begin piloting an alternative payment model for providers of MIHP, or the Maternal Infant Health Program, which, as you know, serves more than 15,000 Medicaid eligible pregnant individuals and 20,000 infants annually. This program is covered by Medicaid, and it is still our largest evidence-based home visiting program. Michigan's home visiting, as you know, provides valuable services to families in Michigan and does leverage federal funding to do that. It's just as important that we find these meaningful ways to address behavioral or mental health problems as it is to address physical health at any stage of life. And any of you who know me or have worked with me know that I fully believe we should be treating behavioral health issues in the same way that we treat physical health issues. Everyone should have access to behavioral health services when they need it. And I find it heartbreaking that this is not always the case. It is one of my top priorities as director. Public behavioral health services serve over 300,000 people in Michigan, which includes youth with serious emotional disturbances, adults with serious mental illness, intellectual and developmental disabilities, and substance use disorders through our 46 community mental health agencies and our 10 PIHPs. However, only 1/10 of the 1.3 million Michiganders living with behavioral health disorders are served by Michigan's public behavioral health system, and over half with a mental health diagnosis and nearly 70% with a substance use disorder do not ever receive treatment. For children, we're working with partners on a plan to improve delivery of behavioral health services with mental or behavioral disorders, developmental disabilities, particularly focusing on children in the Medicaid system or served through our child welfare system. Resources in schools have long been scarce, and our kids spend much of their day in this environment, so you will always hear support from me for policies that drive more behavioral and mental health services in school settings. In the context of COVID-19, our Behavioral Health Administration really just stepped forward to, create services to help people by establishing a host of resources, which included establishing peer warm lines, crisis counseling services that were available every day, informational brochures, materials, and videos. as well as virtual support groups for vulnerable populations. Especially important last year, and as we work through this pandemic, this really unprecedented time that none of us knew what was going to happen. None of us knew what to expect, but that we were all experiencing that together. And so having the ability to connect with each other, to share our concerns, our anxieties, and our fears was so important to maintaining the connection with other people that we were so immediately missing because of the way that we had to try to slow the transmission of COVID-19 across the state through isolation. It was so important to have those resources. However, even before the pandemic, we needed to expand our behavioral health support services for children and adults. Our teams continue to focus on expanding services for people with opioid use disorders, including the expansion of behavioral health and opioid health homes, so that people are receiving comprehensive and coordinated care management. Increased access to the quality of physical, behavioral, and children's health services will absolutely lead to improved outcomes, and better alignment of these services to address individual needs. Policies aimed at directly addressing social determinants of health and the experience of a person across a lifetime and across their entire life in any given moment will also lead to improved outcomes and better alignment, Policies that improve transportation, education, healthy food access, or infrastructure are also crucial for health outcomes and long-term health goals as a state, as you all know. One of the areas we're working on is making sure that kids have a safe and healthy, stable home by working with kids and parents. While children aren't the only people impacted by lead, for example, childhood lead exposure is still a serious and widespread problem in Michigan, particularly in low-income areas where families live in older, deteriorating housing units. We welcome new ways to address this issue from all angles, and we continue to prioritize the reduction of lead exposure for children by identifying risk factors at the local level, improving the identification and monitoring of lead-exposed kids, and targeting our service and resources locally. We continue to expand current solutions and identify new innovations to reduce lead exposure for long-term social, economic, and health benefits. It will not come as a surprise that over the past year, we have seen significant decreases in lead abatement activities and testing. But of course, we assume that this is related to the pandemic. We are committed to continue to collaborate with health and policy partners, providers, and of course, families to ensure that we have a stable level of lead testing and abatement activities across the state. And we continue to work to increase awareness of the importance of this testing through messaging in public health and in partnership with our healthcare providers. In addition to testing, increasing our lead abatement workforce continues to be on the forefront, and one of our goals is to continue to build a statewide lead abatement capacity fund for all lead hazard control programs. Another priority not traditionally thought of when discussing health policy is reducing our foster care placements and finding ways to support families. This always is a priority for us. We know that kids have better outcomes across the board when we invest our time and energy into equipping biological parents and families with the resources they need to create safe, stable home environments. So it is critical that the policies being shaped in legislatures support a focus on helping families stay intact whenever possible and safe. Through the incredible work of our team, the number of children in Michigan's foster care system is at a 12-year low. We attribute this to a focused effort to increase services and community support for families. And this year, we will begin a huge undertaking by replacing our casework system, our IT platform, MySAC, with a new system that will be, hopefully, easier to use for our workers and our partners in this area. This represents another significant step in our effort to overhaul our technology to better serve children and families and provide reliable data to track the performance of our welfare system, which involves CPS, foster care adoption, and juvenile justice. It will allow our workers to spend more time with kids and families, which is a main priority for us in achieving these goals. It also provides more reliable data to our employees who are investigating child abuse and neglect and helping youth in foster care and those facing JJ cases. There are also exciting opportunities in the area of income and food access across our programs and policies that impact us from children through adulthood. We have a lot going on, so I'm only just touching on a few things here, but as you all know, I'm willing to go into detail on any of these items at any point. So I'll look forward to some of your questions. During the pandemic, we did also take several pretty big steps toward food access for families and children who rely on school-based nutrition programs, which was especially important when it wasn't safe for kids to be going to school in person, and working closely with the Department of Education. So we became one of the first states to deliver emergency allotment food assistance since March of last year, which allowed households to receive the maximum food assistance using federal dollars. We were the first state to issue pandemic EBT benefits to nearly 900,000 children who are eligible for free or reduced lunch benefits. So important to make sure that these kids still had access to the nutrition that they needed, even though they were not able to be in the normal environment where they were receiving those. And we were able to implement online EBT technology, so food assistance recipients could purchase groceries online through Amazon and Walmart. So important. We expanded student eligibility for food assistance to include those eligible for work study and those with a $0 estimated family contribution on their FAFSA. We saw the elimination of the drug felony ban that prohibits people with 2 or more drug-related felonies from receiving food assistance. In the past few years, we've worked with a really great partner in Sevilla in Detroit to simplify our application process for applying for some of our assistance programs within the current parameters of the rules and requirements. And this is something we're working to do for our other programs as well. We rolled out our streamlined renewal process last year, and right now we're partnering on a change that could achieve faster determinations for assistance, which kicked off last week. I was able to be in one of the kickoff meetings, talk to some of our county staff who are going to be piloting this new process to speed things up, and everyone is really excited to take on this challenge and be able to meet the needs of our friends, our neighbors, and our communities more quickly than we are currently. These types of changes and the policies that provide room to improve implementation may seem small, but having the ability to make these high impact changes with speed is important. It's our hope that the work of partners like you and the Michigan Food Security Council will lead to policies and collaborative solutions that support food access long-term. From food to health services, access is also a challenge. We know, especially for the aging population in Michigan, our Aging and Adult Services Agency has taken on programmatic solutions like partnering with Get Set Up, a social and learning community designed for older adults with classes available around the clock on every topic. This partnership creates a new free resource for Michiganders 60 and up and has been funded by our really great partner, the Michigan Health Endowment Fund. We know that isolation in general is an issue and one of the most prevalent social determinants, in particular with the aging community. And so working to decrease a person's feeling of isolation is so important in achieving better health outcomes. And over 80,000 older Michiganders have taken classes since this partnership launched in November. So that's really exciting. We still find that most older Michiganders want to age in place, of course, and that is why our community-based services are so important, and maintaining flexibility there is so important. Another critical issue, and one that we focused a lot on over the last year, is the need for more direct care workers, job training for those workers, and improving wages for those workers. From 2018 to 2028, there will be a projected 178,000 direct care job openings in Michigan. So we have worked with the Direct Care Worker Advisory Committee, which is being led by our Aging and Adult Services Agency. This committee includes representatives from state agencies, advocacy groups, providers, and others to help direct our policies and our strategies to meet that need over the coming years with direct care workers. It is also estimated that in Michigan, over 400,000 individuals provide unpaid care to family members. And so we need to continue to make sure that we're offering resources and training for those family caregivers, especially important providing respite care, counseling, and other services to ensure that they are not themselves burning out in providing that care for their loved ones. So that was a lot of information in a short amount of time. But what lessons have we learned from the pandemic? I learned more than I ever thought I would about a number of topics I never thought I would learn about, working very closely with partners that I never had an opportunity to work with before, including the National Guard, state police, and others, which was really exciting. Being able to operationalize a number of strategies very, very quickly across the state, but also really focusing on how we really truly meet people where they are, because geographically, our state is so diverse, and with a population that is so diverse, and the needs of individuals in different places vary, and the ways that they can access services vary. And so the importance of being able to provide those services to people in a way that is convenient for them has continued to be a focus for us over the last year. What can we do in the policy sphere to address the root causes of some of these negative health outcomes that were exacerbated by the pandemic? I think, as I've mentioned, we have tried to address a lot of these, but recognize the opportunity in front of us to learn from the pandemic and continue to fill in those gaps. So whether the issue is maternal infant health, lead exposure, health coverage, food security, we are at our strongest when our policies allow us to meet people where they are, and when our policies not only address issues now, but also try to address issues in the future. Because when we're looking at the root cause, we're going to be able to make changes that reverberate through the years and decades to come. Sometimes getting there leads to uncomfortable conversations, but any of you who know me and have worked with me know that I don't have a problem with uncomfortable conversations. And I think it's really important that we have those conversations, because the only way that we're going to find those root causes and really be able to understand each other and the way that we approach policy making is to have those uncomfortable conversations. I find that when I'm in a room with people who don't immediately agree on a policy path or solution, we always have something in common that's a starting point, and generally that is our objective. So we need to talk about how to achieve those objectives in ways that not only do we think make sense, but actually work for the people that we're serving. And we really need to take a good look at how we get that feedback and leadership from the individuals that use the programs that we offer at the state level. I want to thank all of you who've been great partners to us over the years, and I look forward to coming together and continuing to find common ground on all of these issues and others moving forward. Thank you so much for your time, and DJ, thank you so much for this opportunity.
Well, as you said, there was a lot there. I appreciate all your comments, Elizabeth. Hopefully there's not too much of an echo. We'll navigate through it. And I got a couple of questions here with some specifics I want to throw your way from the audience. Joanne Sheldon asks about the department's position on the integration proposal and associated legislation put forward by Representative Mary Whiteford. A lot there in that short, simple question. Do you want to parse through that a little bit?
First of all, hi, Joanne. It's good to hear from you. Second of all, our focus right now is working on expanding access to services across the state. So we're really looking at building up our infrastructure so that people have access to services regardless of where they are in their needs, whether that is mild to moderate or acute, and for individuals of all ages. So we've been focusing our time there. I understand that both the Senate and the House have different proposals. We certainly are watching what's happening there, but we have not weighed in that discussion at this point.
And William Owen asks, how do you think we can use telehealth to optimize behavioral health care and access better than we do today?
I think we have so many opportunities, especially when it comes to kids. And this is one thing I think we all need to think about when we're creating policy. We're all looking at things from our biased opinion, our perceptions and our experiences. One thing personally for me, as I saw my kids, and many of you know I have a bunch of kids at home, transition to online school from in-person school, it seemed to me that the transition was more difficult for the teachers than it was for my kids, because my kids are so used to interacting this way with each other. This is not odd or awkward for them. And so being able to use that to provide those services and bring those services to children will really give us an opportunity to make that more accessible across the state. In fact, I think with many kids, they're more comfortable actually interfacing with people virtually than in person, which is a discussion, elsewhere about technology and its effect on children. However, if we can use that to bring people face to face with a psychiatrist or other behavioral health professional, I think we should take advantage of it.
Riley Anderson says, citizens in Flint continue to express distrust of the water available to them. So how does the department plan to bridge the gap between the community and officials? That's the question, but I'm wondering if you could speak directly to this sort of bridge building piece and communication and trust building rather than just policy.
I think it's really important to make sure that we develop and maintain relationships with our partners, whether that be a government agency, a provider group, or the citizens with whom we are working and providing services. And we need to be consistent, and we need to be honest, and we need to be open about what we're doing at all times. And I think if we feel that we can't be, then we need to readjust our policies and our strategies, because we need to welcome all of those partners into the way that we develop our policy and the way that we implement it. And the only way to do that is to do that through group projects, essentially, and making sure that everybody who is touched by those policies is able to know, understand, and contribute to the development of them.
You mentioned your kids, and you mentioned a lot of stuff on your professional plate. I just want to ask you one last question about what gives you hope as a person. It could be professional, personal, whatever, but what gives you hope? What inspires you to keep doing the work you're doing as we sit here in May of 2021? I always like to end on kind of a positive note. So what motivates you?
All of the people that I work with in the department who are so dedicated, so brilliant, so intelligent, so committed to the work that they do, whether that's the people that we have in the lab who are right now doing genomic sequencing for our variants, which is so cool, or our county office staff who are working to make sure that they're able to turn around application times in 24 or 48 hours. And everybody in the department is so willing to look at how they can always improve, how they can serve their neighbors and their communities. It makes me so excited to be able to lead this department and support all of those individuals in the work that they're doing. And that's what keeps me going, because I'm really in awe of all the people I get to work with in the department.
Well, you've been very generous and gracious with your time. I really appreciate you coming to join us here bright and early. Elizabeth Hertel, Director of the Michigan Department of Health and Human Services, thank you for being here with us. I appreciate it.
Thank you so much. Have a great day.